Can a facelift and rhinoplasty be done together? Absolutely. The answer to that is absolutely yes, and I commonly do it. And there are a couple of really big advantages to doing it at the same time. One, the healing is simultaneous. And I'm going to talk in a little bit about the healing from each of these procedures separately and then together. There's another big advantage. Occasionally, I need cartilage to reconstruct the nose. There's a cartilage deficit, and this is really true with a person that's 55 years old. They had a rhinoplasty at 25. Their nose was a little bit over-resected in a given area, and we need a little cartilage to reconstruct it. I make an incision behind the ear to lift up the neck and face. And as part of that, I can harvest a little cartilage from the bowl of the ear. It does not change the structure of the ear, but I have easy access because it's the incision that I normally make when I'm doing a facelift. So I'm not making any other incisions, and there's not any more healing, and I'm taking a little cartilage out, a small amount of cartilage that I can put in the ala. Sometimes people have over-removal of cartilage, or some of their bridge has been over-removed. I have access to that. So does a facelift, when done by itself, change your nose? That's an interesting thing. I would normally have thought no, but many years ago, I believe it was 2002, a very smart ex-fellow of mine and I did this study about deep plane facelifts, the kind that that I use all the time, and we looked at breathing after the deep plane facelift. Breathing through your nose. It's an interesting thing that we found. We looked at rhinomanometry, how people breathe through their nose before and after a facelift. And we found that if the cheek lift was well done during the facelift, it actually helped the breathing. It's interesting, many of my patients that come in to talk to me that want their nose done and say, I want you to change the shape of my nose, but I also don't breathe well. When I do this, I breathe better. I breathe better like this. They're doing sort of lifting the valve of their nose open. So a well-done facelift can actually do that. I wouldn't have thought this unless I did this categorized, systematic study that was performed by an ex-fellow of mine who was really wonderful. And he did rhinomanometry before and after facelift without rhinoplasty, and their breathing was better. How long is the recovery after a facelift, and how long is the recovery after a rhinoplasty? Well, I find they're close to the same amount with each, and if you do them together, you have simultaneous recovery. So the facelift doesn't add to the rhinoplasty, and the rhinoplasty doesn't add to the facelift, and you get a simultaneous recovery. But with facelift surgery, as a general rule, after about 10 days, people look pretty good, maybe sometimes 8 days. The first few days, they look funny. After a rhinoplasty, you wear a splint on top of your nose for the first week. So for a week, you look funny just from having the splint on top of your nose. At about 8 to 10 days after a facelift and a rhinoplasty, most people look good enough that they can go out in public and do most of the things that they do. I wouldn't have them do kickboxing or weightlifting at 10 days afterwards, but they could do most activities, and certainly most social activities, if you heal like most of my patients. So if you have questions about this, you want to know about your face, your neck, or your nose, call me. Schedule a consultation with me. I'm here for you. You can email me, our office will respond. We do virtual consults as well as in-person consults. I look forward to seeing you. Thanks a lot for watching.